Hello, everyone, and welcome to Science on 7th, where we talk about air pollution and health with experts around the world. Today, we will be speaking with two eminent experts on air pollution and children's lung health. Some of you may know that last week, many of us observed, celebrated the Air Quality Awareness Week and also the World Asthma Day on May 3rd. We often hear that air pollution is responsible for a lot of deaths in countries around the world, but it is equally true that air pollution also causes diseases that people live with over their lifetime, over many, many years, and they have to be treated. One of those diseases and one of those organ systems in our body that is severely impacted by air pollution is our lungs. And today I have two excellent guests that are going to tell us a little bit more about how air pollution affects the lungs, especially in children. So first, I would like to welcome Dr. Rebecca Nantanda, who's joining us today from Kampala, Uganda, where she works at the Makerere University Lung Institute and is a trained pediatrician and has been working with children for many years. Welcome, Rebecca. Um, Next, I would like to welcome Dr. Rosalind Wright, who's joining me from closer to Boston. Welcome, Dr. Wright. She's also a professor at Mount Sinai in the School of Medicine and has been working on research and also with patients for more than 3 decades now. So welcome, both of you. I'm very excited to have you here. And I know we have a statistic up here, if we can pull it up to just see some highlights of how we hear about air pollution impacting our lung health. I think globally, based on the estimates we have from State of Global air pollution is responsible for a variety of lung diseases. But in recent years, we've seen headlines such as these, poor air quality causing respiratory illnesses in children, and often pediatricians are talking about this now. We've also had a statement from the American Academy of Pediatrics. Similarly, examples from countries around the world, from Sweden and England and India and Kenya and Uganda and Colombia, that air pollution affects children's health. So, Dr. Wright, let me begin with you. We hear a lot about air pollution being a problem for children's health and that air pollution affects them disproportionately. They're more vulnerable to air pollution's impacts. Why are they more vulnerable? Can you tell us a little bit more? And how do we know that they're more vulnerable?
Absolutely, and it's wonderful to be here with everybody today. So this vulnerability to air pollution starts very early as children grow, and you can think about children being most vulnerable when they're growing at their most rapid rate. So vulnerability to air pollution actually begins in the womb. As the lungs grow over pregnancy, they're rapidly developing, and this development needs to happen in a very organized and time-sensitive way. So if you're exposed to some toxic environmental factor like air pollution during this rapid development, you can throw off that organized development of the lung, and they may develop abnormally, predispose the children to having lower levels of lung function, which can have health impacts, but also predispose them to lung disease earlier in life. So how does it get to the fetus developing in the mother's womb? Moms breathe the air. And so if moms are breathing in the air pollution, it can actually happen directly because some air pollutants cross through the lungs to the bloodstream and get to the baby through the placenta, so they can have a direct toxic effect on the developing child, including the lungs. But also it disrupts mom's biology. We breathe in air pollution. It can change the way our immune system functions. It can change the way other key systems like our nervous system functions. This sends signals to the developing infant during pregnancy, including changing how lung development occurs. And then once the child is born, of course, they're breathing the air themselves, and now they're taking in the air pollution, and it can also affect these systems in their own bodies, and that gets to the lungs, and we know that very well. So why are they more vulnerable than, say, a bigger person, an adult? Well, there are several reasons. Children breathe more rapidly than you or I, so they take in more of the air pollutants into their lungs, so they get a higher dose, if you will. Their behaviors are different. They spend more time outdoors. They may be more active when they're outdoors, like playing sports, and that's a good thing, but it also can make them more vulnerable as well. And then just as their lungs are still growing, um, other systems in their body, like enzymes that are able to detoxify things that get
Mm-hmm.
into our body and get rid of them. You and I can sort of get rid of them and keep going on and no problem. And so they can be more vulnerable that way. And the other thing to remember is the lungs are really a unique organ system. They don't stop developing right after birth. They actually 80% of the air sacs that help us take the oxygen in and out develop after birth. Lungs continue to grow all the way up into late adolescence, early adulthood. So we have to be thinking about it all across the childhood.
Fascinating. This as you were speaking about this, I was thinking back to my childhood. I grew up in Delhi, and I was definitely spending a lot of time outdoors with my friends. So I'm thinking of how much pollution I was breathing in at the time. This is several like decades ago now, but still. And Dr. Nantanda, I know that your work has also focused on children's health. You work at the Lung Institute in Kampala, and I'm sure you see children from across Kampala and perhaps across the country and across East Africa. So, what kinds of diseases do you see in children in relation to lung health, and what have you observed in terms of air pollution exposures and how that might be impacting their lung growth and also diseases that they come to you with?
Thank you. The most common lung diseases that is associated with air pollution in our environment is pneumonia. In fact, in
Mhm.
Uganda, pneumonia in childhood is the second most common cause of death and ill health within that population. But when it comes to actually children visiting the health facilities, it's cough. The most common reason why parents bring their children to us is because of cough. And this could be because of pneumonia, it could be because of other respiratory infections, but also within the Lung Institute and even other places or other hospitals, we are increasingly seeing a high number of children coming in with asthma symptoms. And knowing that much as we are a low income country, but we are rapidly urbanizing, this comes with more cars, it comes with more industries, it comes with an increased population that is working within the centers. We are seeing a lot of air pollution, and therefore the diseases are also increasing. And I
Mhm.
just want to talk about the children who is in the rural setting. We've clearly done research that has shown us that even those children who are not anywhere near cars or industries, because there is a lot of use of wood fuel, and the
Mm.
behavior that traditionally the little children are in the company of their moms during cooking, during burning rubbish and all that. So they get exposed to air pollution early on in life, let alone what my colleague has explained when the mom is already exposed during pregnancy. When they come out, they actually continue the problem of being exposed because of the behavior around cooking.
Fascinating. Often we hear that, oh, if you're living in a big city, there's going to be more pollution. You go to, maybe like countryside, rural environment, you're going to experience less air pollution. But of course, every country is different. And I think, highlighting that rural areas too can have a lot of air pollution is important. And I've seen both of you mention two diseases. You've talked a little bit about pneumonia, Rebecca and Rosalind, you talked about also like starting to develop lung diseases. We've heard in many news reports recently about asthma being a problem, that air pollution can cause asthma. So Dr. Wright, can you tell us a little bit more about asthma? What is this disease? How does it present in children? And what do we know about its links with air pollution?
Sure. So air pollution or asthma is a disease of the airways of the lungs. So you and I, when we breathe air in and out of our lungs, we have a whole series of tubes that carry that air from when it goes in from our nose and mouth down in through our lungs, and it has to pass into our bloodstream to oxygenate us. So you can think of it as asthma as a disease of those airways. It makes those airways narrow in different ways so that when you're breathing in, people describe a sensation of feeling tight in their chest. They can't get the air in as well. It takes them longer, and it takes them longer to get it out. It's like breathing through a smaller and smaller straw, if you can think about it that way. Now, what causes that? And air pollution is one thing that has been linked to it. Even starting in pregnancy, mom's exposure has been linked to increased risk of asthma in their kids, as well as early childhood exposure, increasing risk in children. what does it do? I already mentioned it can disrupt not only how your lungs grow, but it can disrupt key systems like your immune system. And asthma is
Mm-hmm.
largely a disease of dysregulated immune function when you're talking about children. And it makes your airways more, if you're breathing in some trigger or some irritant, it might make your immune system respond by filling the airways with mucus in
Mm-hmm.
and so that narrows the airway. So you can imagine now you got to breathe around that, and that's some of that tightness. But there's also other things like muscles that are around those airways that help them constrict, or when the muscles relax, they open up more. And I also mentioned earlier, exposure to things like air pollution can disrupt how your nervous system is functioning, which feeds those muscles. And it may not relax and constrict in a normal way. So when you're breathing in an
Mm-hmm.
allergen or an air pollutant or tobacco smoke, it might respond by tightening. And you have to have medications to help manage that. Now, it's interesting that we also talked about pneumonia. If you get things like immune function disruption from air pollution, it can change the way you can fight off those infections and make you more vulnerable. So the immune system plays a key role, but it's not the only thing.
Mm-hmm.
There are lots of different ways it can affect your lungs.
Yeah, very, very interesting. And I think I like your analogy of like try to imagine breathing through a smaller and smaller straw. That's got to be difficult. And Rebecca, I know your work has also focused on understanding how air pollution is linked to respiratory infections in children and asthma in children. So, based on your work in Uganda and your collaborations with people elsewhere, what are you finding in these settings? Because we do hear statistics about asthma being a disease that is more prevalent in high-income countries. We see larger burdens in countries like the US or in some of the Western European countries rather than in Asian or African countries. But what is your research showing, and where are we heading, with these types of trends?
And asthma is actually increasing when you look at the studies that were done previously and what we are studying now. We are increasingly seeing a bigger number of children who are presenting with asthma symptoms. It may be two ways, probably because of the urbanization that I talked about, more
Mm-hmm.
people in the cities and urban settings, but we're also increasingly getting more skills on how to diagnose asthma and stuff. We're able to identify those children who are having asthma diagnoses. Now, very interesting in the work we have done, we've compared the number of children with asthma symptoms in the rural setting compared to those in the urban settings. The number of children in the urban settings are much more. It's actually 3 times more than we see in the rural setting. And that's why we think air pollution, which is very high in urban settings, is very important. And I want to clarify the urban setting of Uganda is probably much more different from the one in New York. In Uganda, it's both the household air pollution because of cooking using the solid fuels, the charcoal. We have a lot of roadside cooking. And so these children experience both the outdoor and the indoor air pollution. So it's a double burden for them. And probably that's why we are really seeing an increasing number of children within urban settings having asthma, but also other respiratory illnesses in that age group. And it cuts across those who are less than 5 years. We've done work in those children who are adolescents. Is still a big problem. About 2 in every 10 adolescents has asthma symptoms. So it's a challenge across the entire childhood as well as the adolescent stage.
Very interesting, but also, somewhat scary that we're seeing increases in rates of asthma in children, even in countries where we didn't, see that for the last few years. And I'm wondering, Rosalind, if you can tell us a little bit about, we've sort of talked around air pollution affecting lung health. I know we have a graphic here, if you can pull that up. Globally, about 30% of lower respiratory infections are linked to air pollution. And both of you have already mentioned these things, more infections, asthma can be exacerbated. You can have new cases of asthma in children, and often it presents as cough. And there may be pain in the chest, but some of the kids that are probably coming to you are very young and may not always be in a position to sort of verbalize what their symptoms are or how they're experiencing this problem. So how do you go from realizing that this may be asthma to we know this is as a result of air pollution exposure, or is it a result of maybe other allergens or other irritants in their surrounding environment? So how do we try and make that connection between if someone is experiencing these symptoms, this must be or this can be as a result of air pollution versus any other risk factor that might impact their health?
Yeah, I can start. We have to educate healthcare providers. I mean, the literature is very clear and the science is very clear that even exposure to air pollution has impact on even earlier onset asthma. 50% of asthma manifests by the time a child is 3 years of age and 80% by the time that they're 5. That's what most of the data suggests. So we have to have our antenna up when a kid keeps presenting with lower respiratory tract infections, wheezing that you can hear on exam. It's not always asthma, but you have to be cognizant of when somebody's having recurrent events like that, this is asthma. And the sooner you can diagnose it and start treating it and decrease the inflammation, that child's lungs are going to grow and develop much more normally. So it's very important to have that early recognition, I think. And particularly in certain environments, as we've talked about, a healthcare provider will take a history of these types of exposures as well, and as we grow to understand that air pollution, indoor air pollution related to cooking, outdoor air pollution related to where you live, has an impact. This is important information to make you even more likely to think that this is something that might be going on.
Rebecca, how has that experience been in your case when, very young patients might be coming to you with these very varied symptoms? How do you sort of counsel them and, work through what might be causing this?
I think the first thing is when you take a history, especially when you take the environmental history, to try and find out where do these children live, what activities go on that could lead to air pollution. But also very important, if they are school going, the kind of school where they go and the environment within the school, because we know that children are exposed at home, during transit to school, but also within the school environment. So that history is extremely important for the healthcare provider to actually pull it out, because we are still struggling with people trying to link air pollution to the symptoms they see in their children. And so when you ask those questions, then the parents sometimes are able to actually start linking. So when it comes to telling them about the diagnosis and the possible linkage to the air pollution, then when it comes to health education, it becomes much easier. And the next time you see them, they can actually tell you that when I made maybe such small changes, now I have not been to the hospital as frequently as I used to be. But I think the biggest challenge right now is we need to take a comprehensive history, every healthcare worker trying to link what you see to air pollution, whether it's an infection, whether it's asthma or any other illness, as long as the child presents with cough symptoms, it's extremely important. Yeah.
Rosalind, we're not hearing you. I think you may be muted.
Oh, sorry. Yeah, I did mute just to decrease the noise. Also, you just have to be aware they could present in an atypical way with cough. Now, so you're looking for both things, right? Is it an infection? Are they coughing because they have some kind of lower respiratory infection, or is it really asthma? It can present that way, particularly in younger children, in that atypical way.
Right. It looks like a lot of, thinking and sort of some level of detective work goes into this and taking the history and trying to make those connections. But I'm also curious to, hear how as physicians, you both got interested in learning more about air pollution. I'm sure this is not the top of the agenda of pediatricians and doctors. So, Rebecca, if I can start with you on, what got you interested in getting more involved on environmental health and air pollution, and where that connection sort of came from.
Yeah, it started with a student, a master student in pediatrics that I was supervising, and their research topic was looking at air pollution among school children in relation to asthma symptoms. So, because I was already interested in asthma, at the beginning wanted to find out how many students, what proportion of students in these schools actually have asthma symptoms. But then we went ahead to say it was kind of a pilot. Let's also measure the air pollution they're exposed to in schools. And so we had starting monitors there for like 3 months. And then we measured the symptoms. And surprisingly, there was this huge correlation between the asthma symptoms and the air pollution. So it got us thinking that probably we've been thinking about the allergens, the repeated infections, and different things. It's time for us to look at the environment in which the children live. And this study, we did it between in the rural setting as well as in the urban setting. Again, it was clear that the children in the urban settings actually had more symptoms compared to the rural children. So again, it intrigued us and really motivated us to study more and more around air pollution and asthma, and also other, respiratory illnesses. So we've gone on to do more studies in schools. We've done household air pollution monitoring in homes. And what we have discovered all through is that air pollution is actually a huge, huge problem. And now I'm happy we are having these discussions where we are trying to increase the awareness among the population, where we can clearly link health problems to air pollution, on top of other things that may cause, lung problems. But I think air pollution right now should come on top of the agenda so that we consciously go out there to look for those problems. We see how to intervene and actually improve the health of the children. Yeah, but that's how my journey has been from my students to where I am now. And now when I'm doing the clinical practice, it's a routine. I probably may not have been putting a lot of emphasis previously, but when my awareness increased, I'm so interested in the environment in which the children live. If they come in with an asthma attack, what could have triggered it? And sometimes it's because of the pollutants they were exposed to. So it's something which is now part of my clinical practice as well as my research activity.
Fascinating. I think we need to, thank your master students for getting you sort of, set on this path a little bit. How was the journey for you, Rosalind? What got you interested in air pollution?
Yeah, mine was a little bit different. I became very interested in respiratory disease, but I am not a pediatrician. I'm an adult trained pulmonary physician. So I was taking care of adults with asthma as I went into my subspecialty training in Boston, in the northeastern United States, actually. And one thing and I was doing research on genetics of asthma and trying to understand maybe it's the genetic risk or what you inherit from your family. And it seemed that only explained 10 to 20% of what was going on. Yet I was seeing people coming back into the hospital, into the ICU with asthma. And they seemed to be coming from very different communities, specific communities. And we were seeing it in lower income communities in the urban environment. And those who were ethnic minority patients seemed to have more severe disease somehow. And that started me thinking, well, what is the 80% that we're missing that's driving this? And that took me back to School of Public Health and studying environmental factors broadly. And of course, as time has gone on and we see climate change, air pollution has really risen to the top and continues to grow in being a problem. So that was sort of what got me interested in air pollution. And then as a clinician, I got very frustrated with, well, how far back do I need to go to prevent disease rather than taking care of chronic end-stage lung disease where I was seeing people when they're 40, 50, or 60 years old. And that took me all the way back to prenatal and early childhood. So I sit in the Department of Pediatrics, and all of my research is focused in that early life period, because I think that's where we're going to have the big impact. And air pollution is absolutely one of the factors that is, again, is top of the list in what may be driving this. So what do we do about it? Well, in this country, our Environmental Protection Agency sets, the data suggests that they need to set standards lower and lower and lower so we can decrease exposure. But there are also other things that as clinicians we can guide folks on, we could talk about as well. So, all the way from my interest in pulmonary medicine to how do I prevent the disease and what are the big environmental factors that are influencing that.
Yeah, very, very fascinating. And, it's very interesting to think that you started by, where, like, how far back do I go to make sure that I'm not getting the patients, and I don't have to treat them. I, I, I think also, as a society, we do tend to trust our doctors very much. Like, when our doctors tell us to do something or not do something, I think we all pay attention. And I think one of my questions to both of you is, how do we get more physicians involved in thinking about air pollution as a possible risk factor? Today we're focusing on lung health, but it is also true for, some of the other diseases that present both in children and in adults. So based on your experiences, and I know, Rebecca, at least in your case, you have been trying to get other physicians trained and sort of sensitized to how air pollution can be an important risk factor. Can you share some thoughts on how, as the science community, we can work more to engage physicians and get their input and their involvement in spreading the message around air pollution, and also ensuring that air pollution is considered as a patient's comes with certain disease presentation. So, Rebecca, if I can maybe start with you and then go to Rosalind.
Yeah, thank you. I think when you look at most of our clinics, they are extremely busy clinics, whether it's primary care, whether it's secondary care, whether it's tertiary care. So most time the physician is preoccupied with treating and treating and treating what they are seeing. But I like my colleague's approach. She asked herself a question: how do I stop seeing so many patients? How can I prevent instead of just treating what I'm seeing? And I think we have to have that mindset change to think, much as we are clinicians, how do we think about prevention so that maybe we reduce the numbers we're actually seeing, or reduce the number of people coming in with asthma exacerbations. And so when we are creating awareness among the physicians, already have to emphasize to public things as well as the, so that they can appreciate what impact this is going to have, even on the patients that they're already having. So awareness creation is very important. But also, because the physician is extremely busy, I think our health systems, we have these routine health education sessions in most of our facilities. It's time for us to start having some of those sessions with the patients. And because it's the healthcare providers who actually give out those sessions, the more you talk about it, the more you're aware, the more you are literate, the more it becomes part of your practice. So I think that approach is going to help us bring the physicians on board, just like we want to bring on board the patients and the caregivers. So awareness would be my first point. Maybe after that, then we'll go into the nitty-gritty of science on actually how air pollution impacts on the health, at what point in time, the need for early life, prevention, right? Early life. I think I would focus more on obstetricians to start with. Many people think it's the ones you already have the symptoms. So at what point do we intervene? Who is involved? Is it only a problem of pediatricians? Is it only for the physicians, or it's for everybody? So awareness, and advocacy are extremely important.
Okay. Rosalind? I think you're on mute. Sorry about that.
No problem. Thank you. Yeah, very well said. Awareness, awareness, awareness. I think that, as you said, if a clinician validates for a patient that this is something that's important, let's talk about it. Let's think together. What can we do about it in the short term? Here's what we're doing about it in the longer term, that kind of thing. But also to your colleagues, over the years, public health has gone into schools of public health, whereas the clinicians have been more around the biological model and treating the disease, as you were talking about before. We need to bring public health, and particularly environmental health, back into the biomedical world and in our world. And that's what we do through a lot of our training programs. We encourage people, if you're doing genetics, we want you to learn about environment and how you have to understand this more comprehensively together. What are the big environmental, factors? Work together with environmental health scientists in the context. You don't have to do it all on your own. It's really team science, that kind of thing. Start early educating folks. I'm very heartened by seeing the number of undergraduate students getting degrees in environmental sciences here in this country and throughout the world. That's more than what I saw when I was coming through, for sure. And I think it's, the more we just validate that it's important. It's important to think about it just as we do, your cholesterol, how much you exercise, all of these things that we're talking to people about. We need to make it as normal as that in our teaching and our thinking. You don't have to solve the problem, but recognizing it and raising awareness amongst your patient is you're halfway there. And then we got to put systems in place to make busy clinicians able to make appropriate referrals or educational programs, or what we think will impact the most in various contexts. I would like to go back to this notion too that you talked about earlier around different pollutants driving effects in different areas of the world. And even if we look here in our urban areas, there's different cocktail of a mix of air pollutant depending on where they're coming from. And we need to understand that, and the science is helping us do that. So we as clinicians, as public health practitioners, can identify how to get most out of your intervention, tailored more directly to what's driving it in any one area. Is it the indoor cooking environment? Is it the traffic related pollution? Is it industry related pollution, or what have you?
Yeah, I think, very, very good words of wisdom from both of you. What I'm taking away from this is we need to engage the healthcare community better. We need to get them thinking about things that they can do, acknowledge that they're all busy, so finding ways to make it easy and efficient for them. And really going back to what you said at the beginning, Rosalind, that this is not something that happens in one point. This is happening pre-conception. This is happening as children are growing. So continuing to keep our focus on what policies need to be made and what we can do even at an individual level to address these exposures. I think we could keep going for another 30 minutes, but we're coming close to an end here. Thank you so much, both of you, for joining and for sharing your thoughts with us. I hope this conversation was helpful for all of you listening in. We will be back next time with some positive stories of success on how cities are starting to address the air pollution. So we see fewer children getting exposed to air pollution overall. But thank you very much for joining, and we will see you next month. Thanks a lot.
Thank you. It was a pleasure.
Thank you. Thank you, everyone.